If you or someone you love is taking a medication right now for allergies, sleep, anxiety, bladder control, or even heartburn, there is something you deserve to know before your next refill. Some of the most commonly prescribed and over-the-counter medications in the world have been linked in long-term studies to a higher risk of dementia. Not because they are dangerous drugs, not because doctors did anything wrong, but because of something called cumulative exposure, a pattern that often goes unnoticed for years. By the end of this video, you will know exactly which types of medications researchers are watching closely, what the science actually says, and what questions to bring to your doctor. Stay with me, because the fourth one on this list is taken by millions of people every single night without a second thought. Let's talk about why this matters so much for people in their 60s, 70s, and beyond. As we get older, our bodies process medications differently. The liver and kidneys, which filter drugs out of our system, slow down. That means a medication dose that was perfectly safe at 50 may build up more in the body at 70. At the same time, many older adults are managing more than one health condition, which often means more than one prescription. This is sometimes called polypharmacy, which simply means taking multiple medications at once. It is estimated that a significant portion of adults over 65 take 5 or more medications regularly, and that number tends to climb with age. None of this is anyone's fault. It is simply part of aging, and it is exactly why researchers have spent the last 2 decades trying to understand how certain drug combinations taken over many years might affect brain health. It also helps to understand a little bit about how dementia itself develops, because it puts today's topic into proper context. Dementia is not a single disease. It is an umbrella term for a decline in memory, thinking, and reasoning severe enough to interfere with daily life, and it can have many underlying causes, including Alzheimer's disease, vascular changes in the brain, and several other conditions. Genetics, overall vascular health, past head injuries, and lifestyle factors like diet and physical activity all play meaningful roles. Medications are one piece of a much larger puzzle, not the entire picture. Understanding that puzzle honestly without oversimplifying it into a single villain is part of what makes today's information useful rather than frightening. It is worth pausing on why this particular topic tends to generate so much fear, and why that fear, while understandable, is not always helpful. Dementia sits near the very top of the list of health conditions older adults worry about, often even above conditions like heart disease or cancer, because of how deeply it can affect independence, identity, and relationships with loved ones. When fear runs that deep, it is easy for headlines and social media posts to oversimplify complicated research into alarming black and white statements. A study showing a statistical association between a medication and dementia risk in a large population is very different from a guarantee that any one individual taking that medication will develop dementia. Our goal in this video is to walk that fine line carefully, giving you the real research without either minimizing it or exaggerating it, so you can make decisions from a place of understanding rather than fear. I want to be very clear about something before we go any further. This video is not telling you to stop taking any medications. Stopping a prescribed medication suddenly, especially ones for blood pressure, seizures, anxiety, or depression, can be genuinely dangerous and can cause withdrawal effects or a return of the original condition, sometimes in a more severe form. What this video will do is give you accurate, well-researched information so that you can have an informed conversation with your doctor or pharmacist. They know your full medical history, and they are the only ones who can help you weigh the benefits and risks for your specific situation. With that said, let's get into it. The first category researchers have studied closely is older, first-generation antihistamines. These are the allergy and sleep medications that have been around for decades, the kind many people keep in their medicine cabinet for hay fever, itching, or occasional sleeplessness. What makes these medications worth understanding is a property called anticholinergic activity. That is a technical term, so let's break it down simply. Acetylcholine is a chemical messenger in the brain that plays a major role in memory and learning. Anticholinergic medications work by blocking that chemical, which is often exactly why they help with symptoms like allergies or sleep. But blocking that same chemical in the brain, especially over many years, is where researchers have raised questions. A large study published in a major medical journal followed thousands of older adults for years. and found that those with the highest cumulative use of strong anticholinergic medications had a noticeably higher risk of developing dementia compared to those who rarely use them. The key word there is cumulative. This was not about taking one allergy pill during pollen season. It was about years of regular use adding up. Let me paint a picture of how this often plays out in real life because it helps make the science feel less abstract. Imagine someone we'll call Margaret, 72 years old, who has taken an over-the-counter allergy tablet nearly every night for the past 15 years, not because her allergies are severe, but because she noticed years ago that it also helped her fall asleep faster. She never thought of it as a sleep medication. She thought of it as her allergy pill that happened to have a nice side effect. 15 years of nightly use adds up to more than 5,000 doses. No single night ever felt risky, but cumulative exposure is exactly that, a slow accumulation that rarely feels dramatic in the moment, which is precisely why it is so easy to overlook. This is not a reason for Margaret to panic. It is a reason for Margaret to bring that specific habit up at her next pharmacy visit because a safer long-term sleep strategy might exist that she has simply never been offered. This brings us to our second category, and it is closely related. Bladder control medications, often prescribed for overactive bladder or urinary urgency, frequently belong to that same anticholinergic family. This is a very common prescription, especially for women over 60, and it makes a real difference in quality of life for people dealing with frequent bathroom trips. The concern researchers have identified is the same cumulative exposure pattern we just discussed. Because these medications are often taken daily for years, sometimes without regular reassessment, the total anticholinergic burden on the brain can quietly build up. This does not mean the medication is wrong for you. It means it is worth an annual conversation with your doctor about whether it is still the right choice or whether a different type of bladder medication with less impact on the brain might be available. Here is something that might surprise you. There is now a way for doctors and pharmacists to actually measure this anticholinergic burden using something called an anticholinergic cognitive burden scale. It assigns a score to different medications based on how strongly they block that memory-related brain chemical. If you take multiple medications, your pharmacist can often calculate your total score in just a few minutes. This is one of the most practical things you can do after watching this video, and we will come back to that action step later, so keep watching. Our third category is benzodiazepines. If that word sounds unfamiliar, you likely know them by their common use, which is treating anxiety, panic, or short-term sleep problems. These medications work differently than the anticholinergics we just discussed. Instead of blocking acetylcholine, they enhance a calming brain chemical called GABA, which slows down brain activity. This is genuinely helpful during a short-term crisis, like an acute anxiety episode. The concern arises with long-term continuous use, particularly in older adults. Several long-term studies have found an association between extended benzodiazepine use and increased dementia risk, though researchers are still working to fully understand whether the medication itself is a direct cause, or whether early undiagnosed cognitive decline might sometimes lead someone to develop anxiety symptoms in the first place, which then leads to a prescription. This is an important scientific distinction called reverse causation, and it is one of the reasons researchers are careful not to overstate what these studies prove. What we can say confidently is that most medical guidelines now recommend benzodiazepines be used for the shortest effective time, particularly in older adults, precisely because of both the fall risk and these long-term cognitive questions. Consider someone we'll call Robert, 68 years old, who was prescribed a benzodiazepine for anxiety following a stressful period after retirement more than a decade ago. What started as a short-term solution during a difficult transition quietly became a daily habit that nobody ever formally revisited. This is an incredibly common pattern, not because any doctor acted carelessly, but because medications prescribed during one life chapter can simply carry forward into the next without a planned checkpoint to reassess whether they are still needed. If this sounds familiar to you or someone you love, it does not mean something has gone wrong. It means it may be time for exactly the kind of medication review conversation we will talk about later in this video. Let's pause here for a moment because I want to introduce something that ties several of these categories together, and it is more surprising than you might expect. Researchers have found that it is often not just which single medication you take, but how many different medications with these properties you take together that matters most. Two mild anticholinergic medications combined can sometimes create a burden similar to one strong one. This is exactly why the medication review we will talk about at the end of this video is so important, and why a pharmacist's full picture of everything you take, including over-the-counter products, can reveal patterns that are easy to miss when you only think about one prescription bottle at a time. Our fourth category is one that quietly touches an enormous number of households, and it is the one that surprises people the most. Over-the-counter sleep aids, the kind sold specifically as nighttime sleep medications, very often contain the exact same anticholinergic ingredient found in allergy medications we discussed earlier. Many people do not realize this because the packaging emphasizes sleep rather than the active ingredient itself. Someone might take an allergy pill during the day for their sinuses and a nighttime sleep aid before bed, not realizing they are essentially doubling up on the same type of brain chemical exposure every single day for years. This is a perfect example of why reading the active ingredient label matters far more than reading the brand name or the marketing on the front of the box. The fifth category is prescription sleep medications known as Z-drugs, a nickname based on how many of their names begin with that letter. These were originally developed as an alternative to benzodiazepines with the hope that they would carry fewer risks for long-term use. In some ways, that has held true. However, more recent research has found that extended use, especially in older adults, still carries measurable risks, including next-day grogginess, increased fall risk, and in some longer-term studies, associations with cognitive decline. Sleep is genuinely important for brain health, which creates an understandable tension. Poor sleep itself is also linked to cognitive problems. This is exactly the kind of nuanced situation where a conversation with your doctor about non-medication sleep strategies, alongside an honest look at how long you have been using a sleep medication, can be valuable. Category 6 brings us to tricyclic antidepressants, an older class of antidepressant medication. Newer antidepressants have largely replaced these for treating depression itself, but tricyclics are still commonly prescribed today for other conditions including chronic nerve pain, migraine prevention, and certain bladder conditions. This is important to know because someone might be taking one of these medications without realizing it falls into a category associated with anticholinergic effects, simply because they were prescribed it for pain rather than mood. As with the other categories we've discussed, the concern is tied to long-term, high-dose cumulative use, not occasional or short-term prescriptions. Picture someone we'll call Elaine, 75, who has taken a low-dose tricyclic medication for years to manage chronic nerve pain in her feet related to diabetes. When she fills out medical forms, she often skips the antidepressant question entirely because in her mind she has never taken an antidepressant. She takes a nerve pain medication. This mismatch between what a medication is prescribed for and what category it technically belongs to is one of the most common reasons people are surprised to learn they fall into one of these 9 categories at all. It is a strong reminder that the name on your prescription label and the broader drug class it belongs to are not always the same thing in the average person's mind, which is exactly why a full pharmacist review, rather than your own memory of why each pill was prescribed, tends to catch things that would otherwise be missed. Our 7th category involves certain medications for nerve pain and seizure control. Some of these carry mild anticholinergic properties, and because chronic nerve pain often requires long-term treatment, the exposure can add up over years, similar to the pattern we've seen throughout this video. Again, this does not mean the medication is inappropriate. Chronic pain that goes untreated has its own serious impact on quality of life, mood, and even physical health. This is precisely the kind of trade-off that deserves a real conversation with a doctor who understands your full picture rather than a decision made from fear alone. Category 8 is one that has generated some of the most debate among researchers, and I think it is important to walk through this one carefully because the story is more complicated than headlines sometimes suggest. Proton pump inhibitors, commonly used for acid reflux and heartburn, were the subject of a widely publicized study several years ago that suggested a possible link to dementia risk with long-term use. This understandably alarmed a lot of people since these medications are taken by an enormous number of adults every single day. However, several larger follow-up studies since then have found much weaker associations or no clear association at all once researchers controlled for other health factors. This is a great example of how a single early study can create widespread concern before the full body of evidence catches up. Most current medical guidance suggests that if you need a proton pump inhibitor for a legitimate medical reason, the established benefits, like preventing damage from chronic acid reflux, generally outweigh this uncertain and still debated risk. That said, these medications are sometimes prescribed for longer than necessary, so it is still worth asking your doctor whether you still need the same dose you started years ago or whether it might be time to reassess. This particular story is worth remembering any time you see a dramatic health headline online. The original study that raised concern was observational, meaning it looked at patterns in existing health records rather than directly testing cause and effect. Observational studies are valuable starting points, but they cannot fully separate a medication's effect from the effect of the underlying condition it treats, or from other health differences between people who take a medication long-term and those who do not. Larger, more carefully controlled studies published afterward found the original association weakened substantially once these other factors were accounted for. This does not mean the first study was wrong to be published or wrong to raise the question. Science often works exactly this way. One study raises a possibility, and further research either confirms, weakens, or disproves it over time. It simply means that a single headline should rarely be the final word on any medical topic for any medication. Our ninth and final category is long-term use of oral corticosteroids, medications often prescribed for inflammatory conditions like severe arthritis, asthma flare-ups, or autoimmune conditions. Short-term use of these medications, such as a 2-week course for a flare-up, has not shown the same concerns. The research attention has focused specifically on extended high-dose long-term use, where some studies have observed effects on memory and brain structure over time. If you have been on a steroid medication for a long-duration condition, this is a very reasonable topic to bring up at your next appointment, particularly to ask whether the lowest effective dose is being used. Now that we've gone through all 9 categories, I want to step back and give you the bigger picture, because I don't want you to walk away from this video feeling alarmed about medications that may genuinely be helping you. Here is the most important thing to understand. An association found in a research study is not the same as a guarantee of cause and effect for any individual person. These studies look at patterns across thousands of people over many years. They are incredibly valuable for helping doctors and researchers understand risk at a population level and for helping guide medical guidelines going forward. But your own body, your own health history, and your own combination of conditions and medications are unique to you. A medication that shows up on a research list is not automatically wrong for you specifically, especially if it is treating a condition that itself carries serious risks if left untreated. So what should you actually do with this information? Here is the practical part of this video, the part I promised you at the beginning. The single most valuable thing you can do is request what is called a comprehensive medication review from your doctor or pharmacist. Many pharmacies offer this as a free service, and it typically takes about 20 to 30 minutes. During this review, you bring in every single medication you take, including over-the-counter products, vitamins, and supplements, not just your prescriptions. The pharmacist looks at everything together, checks for that anticholinergic burden score we talked about earlier, checks for interactions between medications, and identifies anything that might be worth discussing with your prescribing doctor. This single step, done once a year, is one of the most protective things an older adult can do, and it costs nothing in most cases. Second, when you do meet with your doctor, come prepared with specific questions rather than general worry. Instead of saying, "I'm scared this medication is causing dementia," you might ask, "Is this still the right dose for me at this stage of life? Is there a version of this medication with less impact on memory?" How long have I actually been taking this? And was it meant to be long-term? These specific questions tend to lead to much more productive conversations, and they signal to your doctor that you want to be an informed partner in your own care, not someone reacting out of fear. Third, pay attention to your own patterns of daily use, especially with over-the-counter products. Take a moment sometime this week to actually read the active ingredient list on your allergy medication and your sleep aid. If you find the same or similar ingredient in more than one product you take regularly, that is valuable information to bring to your pharmacist. Fourth, and this is something that gets far less attention than it deserves, focus on the lifestyle factors that support brain health independent of any medication conversation. Regular physical activity, even simply walking most days of the week, has been consistently linked in research to better cognitive outcomes as we age. This is not about intense exercise or joining a gym. Something as simple as a 30-minute walk most afternoons increases blood flow to the brain and has been associated in multiple long-term studies with a slower rate of cognitive decline compared to a sedentary lifestyle. Staying socially connected matters just as much as physical activity, and it is often underestimated. Regular conversation, whether with family, friends, or a community group, keeps the brain actively engaged in a way that passive activities like watching television simply do not replicate. Continuing to learn new things, whether that is a new hobby, a musical instrument, a language, or even a new recipe each week, builds what researchers sometimes call cognitive reserve, essentially extra capacity in the brain that can help buffer against age-related changes. Managing blood pressure and blood sugar is another pillar worth mentioning here because vascular health and brain health are deeply connected. Uncontrolled high blood pressure over many years is itself an independent risk factor for cognitive decline, sometimes an even larger one than any single medication on this list. This is a helpful reminder that brain health is rarely about any one factor in isolation. It is about the whole picture working together. Finally, prioritizing quality sleep through healthy, sustainable habits, rather than relying solely on medication night after night, rounds out this list. This might mean keeping a consistent bedtime, limiting screen time before bed, reducing afternoon caffeine, or creating a calming wind-down routine. None of this replaces necessary medical treatment when it is genuinely needed, but it works alongside it, and in many cases it can reduce how much someone needs to rely on sleep medication in the first place. I also want to address something directly because I know for some of you watching, this video may have brought up genuine worry about a loved one, perhaps a parent or a spouse who has been on one of these medications for years. If that describes you, please remember that discovering this information today does not mean damage has already been done, and it certainly does not mean you did anything wrong by trusting a prescription that was appropriately given for a real medical need. What it means is that you now have useful information to bring into a conversation with a healthcare provider at whatever pace feels right for your situation. Sudden changes made out of fear are rarely the safest path forward. A calm, informed conversation almost always is. Let's do a quick recap of everything we covered because I know this was a lot of information and it's worth having it clearly organized in your mind. We talked about first-generation antihistamines and bladder control medications, both often carrying anticholinergic properties tied to cumulative brain chemical exposure. We covered benzodiazepines and their complicated relationship with long-term cognitive research. We talked about how over-the-counter sleep aids often quietly overlap with daytime allergy medications, doubling exposure without people realizing it. We covered prescription Z-drug sleep medications, tricyclic antidepressants, often prescribed for pain rather than mood, certain nerve pain medications, the more nuanced and still debated research around proton pump inhibitors for acid reflux, and finally long-term high-dose corticosteroid use. Throughout all of this, the same themes kept appearing. Cumulative, long-term exposure matters more than occasional use. Combinations of medications can add up in ways a single prescription bottle never reveals on its own. And most importantly, the solution is never panic or sudden changes. It is an informed, collaborative conversation with the professionals who know your full health picture. If there is one single action step I hope you take away from this video, it is this. Schedule that medication review with your pharmacist sometime in the next few weeks. Bring every bottle, every over-the-counter product, everything, even the ones you only take occasionally. It takes less time than a typical doctor's appointment, and it may reveal patterns about your own health that you had never considered before. Patterns that are often invisible until someone looks at the complete picture all at once rather than one prescription at a time. It is also worth writing down a short list of questions before that appointment, since it is easy to forget details once you are sitting in front of a healthcare provider. Something as simple as a small notebook or a note on your phone listing every medication, how long you have taken it, and any questions from this video that stood out to you can make that conversation far more productive than trying to recall everything from memory in the moment. Before you go, I would genuinely love to hear from you in the comments. Which of these 9 categories surprised you the most? Were you aware that allergy medications and nighttime sleep aids often share the very same active ingredient? And if you don't mind sharing, let us know what part of the world you're watching from today. This channel is built by a community of people who care deeply about aging well, staying independent, and making informed choices about their health, and hearing from you is genuinely part of what makes this channel meaningful. If this video gave you something valuable to bring to your next doctor's appointment, consider sharing it with a family member who might benefit from it too. Thank you for spending this time with me today, and I will see you in the next video.